traveling, standing, or even walking. Everywhere we can see people tapping on their phones at any time doing anything. Most of the phones have a brand starts with the letter I. In this day and age, people are so undividable from using these I products, not just labeling iPhones or iPads, but also any portable devices that has a touchable monitor.
What kinds of portable devices do you have?
I have iPhone.
And I have an iPhone.
Mm-hmm.
Basically, that's what I have.
Yes, I have one Galaxy S2 and one iPad.
Oh, how much time do you spend on using them?
Around 12 hours.
It is difficult to say that. Usually I have time, I will use it.
What do you use it for?
Maybe for Facebook, playing some apps or some kind like that.
Basically everything like check emails, reply messages, Facebook.
Mainly I use the iPad for homework, but the phone is for checking.
Do you have any problems like your neck will feel painful or your eyes will feel tired when you use them for a long while?
Yeah, my leg always feel tired, even I do not use the Galaxy S2 or iPad, and my finger is paralyzed. Yeah.
Like the back of the neck, because like you always like look down on the device, and the same like with your arms, because like you most of the time hand holding it like to press and like the thumb to get tired. Yeah.
Because of this crazy addiction, our body is actually sending an alarm to us. In recent years, compared with 2010, people who seek for a doctor because of neck, backbone, and thumb ache increased by 38%, which these pains is proved by doctors that is adversely harmed by frequent use of eye devices.
Well, according to my knowledge, eye injury actually is not your eye, the injury to your eye, but is the injury associated with the use of eye products such as iPhone or iPad. Now, most usually it is the condition, a syndrome that are associated with musculoskeletal tensions and musculoskeletal injuries of the upper extremity and the neck. Mostly it is because of the prolonged usage of the eye device. For example, if you are looking at an iPhone or playing with an iPad and you are adopting a posture, a static posture for too long, and you're holding in that posture and using your fingers with concentration of your eyes and your mind, and without moving your posture and keeping it for too long, that would cause the injury.
So can you describe a little bit in details what we will get or what we will get in pain if we do use the prolonged eye devices?
Okay, the most usual complaint that I'm aware of is the stiffness of the shoulder and the neck, and also some more severe conditions might be the numbness of the upper limbs because of the stagnant blood flow and also the tension in the upper trapezius muscles in here and the neck flexor and the neck extensor muscles. That if you do not use your muscle correctly, that can the muscles can get very tense, and it can also impede the circulations to the muscles, and it can change the tension of the muscle, and that would lead to these symptoms.
So how can we do to prevent eye injury?
Okay, the most important is not to addict to a static posture. Now, the best posture is your next posture. That means if you frequently change your posture and let your muscles have chances of movement, contraction and relaxation, that would help the circulation, and that would also reduce the tension in the muscles and in the soft tissues. Now, those are the golden rules that we ask the subjects to practice. When you feel that you need a break, then please take a short break and move your neck around and move your shoulder around so as to improve the circulation.
Like Professor Ng said, in order to prevent eye injuries, there's only one solution. Give yourself a break, Hong Kong people!